Hello, I'm Mary Wykstra, Director for Action for Cheetahs in Kenya. Welcome to the 10th episode of Cheetah Tales. In previous episodes, we have stressed the relationship of people and wildlife. In this episode, we would also like to highlight how a healthy environment, healthy animals, and healthy people impact each other. As we all know from the current COVID-19 pandemic, animal health has a huge impact on human health. For instance, the novel coronavirus is a zoonotic disease that is thought to have jumped from wild animals to humans. Just like the COVID-19, there are other diseases that can be passed among domestic animals, wildlife, and humans. There are some diseases that are very specific to only one species. But sometimes domestic animals spread diseases to wildlife, and if that wildlife is migratory, the virus may be taken into another region, and it may impact even more domestic stock. At the same time, there are some diseases that are easily transmitted to any animal and into people. Let me tell you a short story of how I have been impacted by such a disease. In 2016, while working in the field in a small village in a remote area of Samburu, a puppy of about 4 months approached me in a friendly way. I pet the puppy and it became playful, but when I stopped petting it, the puppy suddenly became violent and bit my hand. It drew blood, so I immediately went to the car and washed the small wound with soap and water. I then asked if the puppy had been vaccinated against rabies. I was kind of laughed at and told that there are no vaccinations for dogs or cats in this region. Because we had done a study in 2009, I knew that dogs in these communities had a short life, averaging only about 4 years. But I had not really thought about vaccinations. I later went to a human clinic, and I had my rabies vaccination boosted because I had already received the series when I was a veterinary technician. And then after a bit more research, I found out that more than 2,000 people died from rabies in Kenya alone each year. Over 90% of those cases are from rabid dog bites. I also discovered that the government of Kenya and other supportive organizations had already begun a campaign to eradicate human rabies through domestic dog vaccinations. Of course, being a cheetah researcher, I was also concerned with the transmission of rabies into the wildlife population as well. Samburu County was not selected to be one of the pilot areas for the mass vaccination campaigns in Kenya. But I did discover that the Zoonotic Disease Unit, which is a part of the University of Nairobi Veterinary Facility, would assist with vaccines, and the Kenya Veterinary Association would assist with volunteer veterinarians. Before initiating our first campaign, we needed to consult with the county health offices and the county veterinarians under the Agricultural Ministry. Both were very supportive of the initiation of this kind of a campaign. Next, we needed to assure that the community wanted and would support the campaign, so we initiated the project through interviews conducted by a veterinary student who had applied with us for an internship. We were very happy to learn that many of the people of this region welcomed the vaccination and that they knew that if a person was bitten, that they needed to take that person to a hospital for treatment. In 2017, together with Dr. Mohsin Lakanawala, we worked with the Mebai Community Conservancy and the Samburu Veterinary Office to conduct our first mass vaccination campaign. We vaccinated nearly 700 dogs and cats against rabies. In April 2018, we received reports that a large number of domestic dogs were dying. Further investigation through another local veterinarian, Dr. Stephen Chege, determined that the disease affecting these dogs was distemper. Canine distemper cannot be transmitted to humans, but it can be transmitted to wild dogs, hyena, and to other large cats like lion, leopard, and cheetah. Later that year, we conducted more surveys through another intern from the University of Nairobi. We determined that distemper had been in the dog population in this region for quite some time, and that it was often confused with rabies. We again vaccinated in a mass campaign against rabies only, reaching about 1,000 domestic pets in 2018. Using information from those previous surveys, we developed a dog disease awareness campaign and extended our activities on domestic dog disease into other areas through partnership with the Owasso Lions Project in the neighboring conservancy. Meanwhile, the government of Kenya was also extending their focus into more areas, so the support from the Samburu County was also increased. As we were planning the 2020 vaccination campaign, a horrible thing happened. An entire pack of wild dogs seemed to be affected with distemper, and that was in September of 2019. We pooled our resources and appealed to veterinarians to launch an early campaign in the area where the wild dogs were infected in an effort to stem the spread before it reached Samburu National Reserve. Like me, the director of Ewaso Lions loves dogs, and together we have committed to improve the health of dogs in the region by naming our campaigns and by making the eradication of rabies and distemper one of our priorities. Hence was born Ginger's Hope. It was named after my own dog, who was my faithful companion for 15 years in Kenya. It is Ginger's hope that we can see the eradication of human rabies in the Samburu region. It is Ginger's hope that we can prevent distemper from shortening the lives of domestic dogs and stop the spread into wild carnivore populations. And it is Ginger's hope that we can improve the care of dogs and other domestic animals through bringing in improved veterinary support into this region. This year was a bit of a challenge due to the locust invasions and the coronavirus, but together we managed to vaccinate about 3,000 dogs and cats against both rabies and distemper. ACK's Ginger's Hope program will continue to work in partnership with Samburu County and the Wildlife Conservancies, our partners, the Animal Care Clinic, Daktari Wildlife Foundation, and Ewaso Lions and their Kura's Pride initiative. Tomorrow, we will have the chance to share more with our international audience about this topic. Please join Mary and some of her partners live on Friday, the 17th of July at 8:30 p.m. in Kenya. That will be 10:30 a.m. on the West Coast and 1:30 p.m. on the East Coast of the United States. Hope to see you there. Thank you.